Good afternoon, everyone. This is the 2024 General Budget Conference Committee, Joint Budget Subcommittee on Health. I am Senator Gustavo Rivera from the 33rd District in the Bronx and Chair of the Health Committee in the Senate. I am the co-chair of this General Conference, and I want to introduce briefly some of my Senate colleagues who are here with me. Senator Neil Breslin, Chair of the Insurance Committee, Senator Cordell Clear, Chair of the Aging Committee, Senator Natalia Fernandez, Chair of Alcoholism and Substance Abuse Committee, Senator Leah Webb, Chair of the Women's Issue Committee, and the ranking member for the Health Committee, Senator Patrick Gallivan, as well as alternate from the minority, Senator Daniel Steck. And now my colleague in the Assembly.
Thank you. Hello, everybody. Thank you. Hi, everybody. I'm Assemblymember Amy Paulin, co-chair with my colleague to my right here, Senator Gustavo Rivera. And together we're chairing the Conference Health Committee, Subcommittee. I'd like to introduce on my side the Assembly members that are participating. We have, to my immediate left, David Weprin, Ron Kim, Carinas Reyes, John Zaccaro, and the ranking member of the Health Committee, Josh Jensen, and John McCowan, who I assume is the alternate. Your turn.
Yes, ma'am. So I will go over some of the, not every single line, but certainly over the Joint Budget Subcommittee guidelines. Co-chairs shall determine all matters of parliamentary procedures unless otherwise specified by the rules. Any dispute with regard to procedure that cannot be resolved by the co-chairs shall be referred back to the General Conference Committee and shall be resolved by the co-chairs of said committee. Co-chairs shall designate a staff person to serve as secretary for the purpose of taking minutes. And an alternate may participate in a subcommittee meeting but shall not vote upon any deliberations of such committee unless he or she has been designated to fill an excused vacancy in such subcommittee. Also, no subcommittee members or alternate members shall be permitted to participate via proxy. And lastly, subcommittees shall restrict their deliberations to their respective subject areas as determined by the General Conference Committee. And any issue which are determined to be non-germane by the co-chair shall be referred back to the General Conference.
Okay, I'd like to take the time to introduce Adam Tenney as the recording secretary for the Assembly. Adam, raise your hand. There we go.
And on our end, we have Kelly Mendoza, who will be the recording secretary for the Senate.
So now I'm going to mention some of the major issues that we will need to be addressed as part of this conference subcommittee. They include the global cap, capital funding, essential plan expansion, financially distressed hospitals and safety net hospital funding, SUNY downstate, nursing home and assisted living providers reimbursement rates, hospital reimbursement rates, long-term care ombudsman program, reproductive health grant funding, and medical debt.
And all of these, we have done good work in the last couple of weeks to really coordinate between the Assembly and the Senate, our one houses, our response to the governor's budget proposal, and certainly all of those issues that my co-chair mentioned are certainly ones that we want to discuss deeply with the administration and hopefully reach a good conclusion. We also want to make sure that we discuss with the executive issues of restoring vital funding and increasing Medicaid reimbursement rates for hospitals and nursing homes and other providers. I've been pretty consistent on this issue. Raising Medicaid rates is the most important thing that we can do to provide stability to institutions that serve the most vulnerable around the state. Hopefully we will deal with issues of increasing funding for reproductive health as well as expanding health coverage for individuals and for all New Yorkers regardless of immigration status. We have talked about this before and hopefully we can get it done this year. And now I want to give an opportunity to some of my colleagues in the Senate if they would like to give brief remarks on some of the issues that are important to them, starting with my colleague to my right, Senator Neil Breslin.
Thank you very much, Senator Rivera, and to the crowd here today. This is probably the most important year for the health group that they've had in the last 20. And it's so important. There are so many issues that affect the most vulnerable in our population. On insurance issue, it's a relatively mild year. And at this time, I would waive any comments on insurance and defer to Assemblywoman Paulin and her group, and to Senator Rivera and our group on the critical areas of health.
Senator Clear, Chair of Aging.
Yes, good evening, everyone. I think I echo the words of Senator Breslin. This is an important year for health, and particularly for the aging, our aging population. I'm very proud of some of the things that have already gone in the One House, and look forward to even more happening for long-term care. The Long-Term Care Ombudsman Program, which is a very important program, and also the nursing home and assisted living providers reimbursement rates, as well as the hospital reimbursement rates, which will provide Medicaid equity. I'm also looking forward for us to continuing the fight for fair pay for home care, to ensure that those who take care of our loved ones make a wage that allows them to take care of their own families. And also to help close the wait list for senior services, and ensuring that all seniors who need home care, meals, transportation, and other vital services receive them. Thank you.
Thank you, Senator Clear. Senator Fernandez.
Thank you, Senator Rivera. Very proud to see the advancements in our One House, and looking forward to the continued negotiations. On behalf of the Committee of Alcoholism and Substance Use Disorder, we have strived to continue to break the stigma when it comes to the work around addiction services, and supporting initiatives like the increased COLA, like the Medicaid reimbursement increase, and making such decisions that would reject the scheduling of substances, which we have seen does not work, and to support initiatives like a drug testing bill, a drug testing legislation that would allow providers to purchase a drug testing machine so we can properly track what are the substances out there. But the negotiations have been great and continue, and I thank everyone for their work in this budget.
Thank you, Senator Fernandez. Senator Webb.
Thank you, Senator Rivera, and also Assemblymember Paulin. And I'll keep my comments brief. Again, I echo the sentiments that have been shared so far. This is most certainly one of our most important budget deliberations as pertains to the health and vitality of all New Yorkers. And as the chair of Women's Issues in the Senate, I'm really proud of the amount of work that we've been doing to address the long-going issues as it pertains to reproductive and maternal health care as a state. We have great resources, and at the same time, we also have significant disparities still as it pertains to these issues. And so I look forward to not only the ways in which we will continue to address those issues in particular, but also other related healthcare needs, as it's been spoken with regards to Medicaid reimbursement rates and so on. So I look forward to our continued deliberation and ultimate negotiations that will be for the betterment of all New Yorkers as it pertains to their health and well-being. Thank you so much.
And lastly, Ranking Minority Member Senator Patrick Gallivan.
Thank you, Senator, and good evening, everybody. I'm pleased to be here on behalf of the Senate Minority Conference. While not all-inclusive, I'd like to touch on just a few areas, some things that we're in agreement with, and some areas of concern that I'd like to highlight. First, we're very pleased to see that both One House budgets have rejected the governor's proposed unallocated cuts to the Medicaid program. Certainly, it's important to ensure the Medicaid program remains in balance, but the governor's proposed millions of dollars of cuts without specifics or details is not a viable option. It's very appropriate to increase the Medicaid rates specifically for hospitals, nursing homes, and assisted living programs. Years of stagnation, as we all know, necessitate increased funding to ensure our state's healthcare delivery system remains viable. And we are very pleased that both one-house budgets include the continuation of the healthcare facility transformation program. I have concerns in two areas I'd like to highlight. First, the $4 billion managed care organization tax that's within both one-house budgets. While this tax would ultimately be budget neutral without requiring additional state funds at this time to fund the Medicaid program, it sets a very risky precedent that could be withdrawn by the federal government, which would necessitate further and future program cuts and tax increases on all New Yorkers' health insurance. Also concerned very specifically with the lack of any meaningful Medicaid cost controls within the one-house budgets. The repeal of the Medicaid global cap removes a key tool to ensure that Medicaid spending does not exceed budgeted funds. I look forward to working with my colleagues to implement a fiscally responsible budget that provides sufficient funding for the healthcare initiatives delivered by the state. Thank you.
Thank you, Senator Gallivan. Assembly.
Yes, thank you. Assemblymember Weprin.
Good evening. As chair of the Assembly Committee on Insurance, I fully support the proposal to eliminate cost sharing for insulin and the addition of the proposal to eliminate cost sharing for epinephrine auto-injectors, commonly known as EpiPens. The accessibility and affordability of these life-saving drugs is critical to the health and longevity of all New Yorkers throughout the state. These two proposals in particular will not only improve the health of millions of New Yorkers, but will also help close the health equity gap and lower long-term health care costs. I will continue to advocate to ensure that these proposals are included in the final budget. Thank you.
Thank you. Assemblymember Kim?
Thank you, Chair Poland. As the chair of the Assembly's Aging Committee, my goal has been to work closely with the Senate Chair, the Administration, and Program Council to make sure that no older adult falls through the cracks of our long-term care system. I also appreciate our staff for working so diligently on the MCO tax, Managed Care Organization tax, which would generate up to $4 billion of revenues for us. Specifically, we focused on ensuring that the thousands of older adults and caregivers who rely on non-Medicaid services receive the home and community care that they rightfully deserve. By investing $42 million that could eliminate 16,000 older adults on the waiting list and their caregivers, we could save up to $2 billion in Medicaid spending in the next 5 years. Simply put, investing in older adults and their caregivers is good for our economy. Second, I'd like to emphasize the importance of making sure we support adult daycares, social adult daycares, and medical adult daycares while rooting out the bad operators in the industry. And a couple of other things that we should be continuing to support. As Senator Clear said, the long-term care ombudsman program is critical to holding the bad operators accountable. They're the key watchdog for our state, for our patients and consumers. So we should fully fund that program. And lastly, we funded technological innovative programs to deal with social isolation and loneliness for older adults, and we should continue to support those programs moving forward. Thank you, Chair.
Thank you. Assemblymember Carinas Reyes.
Thank you. I'm happy to see that in our one House proposal and as well as the Senate, we are taking serious the Medicaid rate increases. I think that goes a long way in the attraction and retention of qualified workforce and healthcare providers, as well as the COLA is also, I think, very important for our social services providers to be able to retain staff. I would like to point out our $30 million investment in certified home health agencies, and that, along with the increase in rates, goes a long way to ensure that our CHAs continue to survive and provide the much needed care that our population, our aging population needs, as well as the rate parity for our FQHCs for telemedicine provisions. So I look forward to the continued negotiations and hope to see those in the final budget. Thank you.
Thank you. Assemblymember John Zaccaro.
Thank you so much, Chair. It's an honor today to be able to serve on this subcommittee. And as an assembly member from the Bronx and someone who represents a district of older adults in high need, I just wanted to continue to amplify and echo the sentiments of this conference on the need for the support for financially distressed hospitals and safety net hospital funding, in addition to the nursing home and assisted living providers reimbursement rates. I know that it has been a commitment of the Assembly majority to ensure that we are leading on this issue. And as a member who represents the 62nd county that falls dead last in health across the state, I just want to make sure that we're continuing to echo these important issues in our borough. So thank you so much, Chair, for the opportunity to speak today.
Thank you. Assemblymember Josh Jensen, who represents the minority on the Health Committee.
Thank you very much, Chair Paulin, for the opportunity to speak on behalf of the Assembly Minority Conference. As we begin the final stages of the budget negotiations, it's our sincere hope that there are five-way negotiations and discussions in an open and transparent manner to ensure the views of all New Yorkers that call our state home are represented. During a time of healthcare workforce challenges and increased costs of providing healthcare, the Assembly minority supports ongoing discussions to assist our Medicaid providers that serve some of our most vulnerable populations. However, the Assembly minority has concerns over the continued expansion of Medicaid and the use of budgetary gimmicks and schemes and loopholes that may fiscally jeopardize the state. Certainly the new $4 billion tax on MCOs will be added to already $6.5 billion in taxes in healthcare and keep us at liberty of the federal government for its permission to access these funds. With uncertainty over the way that California has instituted their scheme of this nature, there is concern that if the federal government either does not approve or withdraws the funding moving forward, that the critically important Medicaid rate increases that are included in the budget would be placed in jeopardy moving forward and would force our providers to deal with uncertainty that they do not need. I'm confident that we can enact an on-time state budget that is open and transparent with input from all legislative conferences.
Our final Assembly member, do you want to say anything?
Thank you, Madam Chair.
John McCowan.
Thank you, Madam Chair. And thank you for allowing me the opportunity to speak on behalf of the Assembly Minority Conference. The executive budget includes $400 million in unallocated savings to the Medicaid program, but does not indicate where these cuts would occur. By leaving these cuts open-ended, it does not allow providers or Medicaid recipients a clear direction of the future of many vital programs. We would prefer these proposed cuts be restored, but if they cannot be restored, the enacted budget must clearly indicate who and what programs are impacted. The Assembly Minority Conference supports full transparency regarding the nursing home case mix freeze and supports freezing the rates at January 2024 levels as originally included in the executive proposal. The legislature and executive should adjust the focus to ensure that Medicaid exists to serve the most vulnerable populations in New York State and work on transitioning individuals to alternative coverage options outside the state subsidized plans. The majorities in both houses of the legislature have shown support to allow individuals to access the essential plan regardless of immigration status. Without a proper way to verify income for this initiative and the possibility of individuals coming to New York to access this program, the Assembly minority has serious concerns over the possible increased cost of this program. The Assembly minority supports including an additional $225,000 over the usual $500,000 for Donate Life for a total of $775,000. I join my colleague Assemblyman Jensen and I'm confident that we can enact an on-time state budget that is open and transparent with legislative input from all conferences. Thank you, Madam Chair.
Thank you so much. Closing remarks? Want me to go first? You want to go first?
Since I began, I think you should probably wrap up, but I'll just say that the Senate majority certainly looks forward to working with our Assembly colleagues as well as the executive to get an on-time and good budget, and we are certainly making progress in that regard. So hopefully we will do that. And that is all from me, Madam Chair.
Ditto from the Assembly side. We look forward to working with our Senate partners and the executive to work out a three-way agreement on time and so that we fully fund healthcare going forward. Thank you all for coming.